all of the talent acquisition, all the work around retention, training, education, and development for non-clinical work, our leader development programs, our comp and benefit programs, as well as just in general, how are we looking at our workforce and what is our workforce of the future going to look like, and how do we have to skill and reskill our staff to meet the demands of the organization and our patients. So that's what I do in 30 seconds, I guess.
Okay. Thank you, Frank. Can you explain to us what the ITEACH values are?
Sure. Well, first of all, I'm really impressed that all of you are really interested in what our values are. I think it's really important to talk about why do we have values, and then I'll talk to you a second about what they are. So values are really important because I think they help us establish and set a stage for how we all work together. We are really working very, very hard on building a really great culture for our workforce so that you can be at your best, so that when you come into work every day, you feel that you can do your best work. You can, as I call, practice your genius, because I think all of you have geniuses in you, and we just need to kind of help get that out. So it's really important to level set, and it kind of establishes how we're going to behave and work together. And that means we set some expectations of you as our colleagues and what you should do, but similarly, you should have those same expectations of me as a leader. We're no different when it comes to our values, and our values are meaningful to our organization. These are not, plaques on walls for us. Just in the short presentation that Brandy talked about, she really demonstrated a number of our values. And so we talk about our values in a simple way of calling it ITEACH values. So first, we're an academic institution. And so the I stands for innovation. So as you can imagine, there's a lot of innovation that happens here. What tends to start to separate us, there are three things in my mind that separate us from the standard community hospital. One, we do things at Nebraska Medicine no one else can do, and that does require an enormous amount of innovation. The second thing we do here is we teach the next generation of healthcare providers and healthcare professionals. So we're actively engaged in teaching all the time. And the real benefit to that to you is you get to stay on the cutting edge of new things going on in and around healthcare. And then lastly, we are engaged in a lot of research and clinical research that we actually then translate that into clinical practice for our patients. So we think that's really, really critical and important. So innovation, there's a ton of innovation that goes on here. And what we also like to talk about with innovation is not just the big fancy stuff. Yeah, we would all love to cure cancer, no question about that, right? But you can be innovative in your job. You can be innovative in doing some simple things like innovating a process, doing something a little differently, approaching a patient differently that maybe you haven't been able to get through. These small things that we do also equal innovation. And we're constantly challenged because of the complexity of our patients to be innovative. And then, of course, we can be innovative with each other in terms of how we're taking care of each other. So innovation is a real high value. Then teamwork, which I think you see in Brandy's explanation, tons of teamwork that goes on among the nursing staff, among the nursing units. They all really rally and support one another. They float when they have to float. And some nurses love floating and some nurses don't, but you know what? They do it because it's a team sport in healthcare. And I could go on and on about teamwork, but I think you really saw that. The other thing we talk about is excellence. And again, 2.5 years of not having a CAUTI infection is crazy good, right? Especially in a complex organization like that. So when we talk about excellence here, we talk about it in terms of quality of care and safety. So safety is our number one priority. We want the safety of our patients and our colleagues to be foremost in our mind. If you don't feel safe physically, emotionally, mentally, even spiritually, then it's going to be hard for you to practice your genius. And so, safety is really critical. We go out of our way with our shout out for safety programs. And also we have what we call a daily shout out, where the 125 top leaders of the organization get together every day at 9:45. And we talk about what's going on from a safety perspective. So that's really, really critical. And then the C is courage. We think it takes a lot of courage to be in healthcare right now, to do what we're doing. We went into the patient units with COVID, we didn't run out of them, right? It takes an enormous amount of courage to do that. It takes an enormous amount of courage to face your own fears as you're going through and trying to deal with a disease early on that we didn't really know much about. So there's an enormous amount of courage. It takes courage to call me out in the hallway if I'm doing something unsafe and I'm an executive and you go, gee, I don't want to get fired. What Will would say to you is, I would expect you to call me out. I would want you to call me out if I'm doing something unsafe. And it does take courage. It takes courage to a surgeon to say, hey, I want to call a timeout because I don't feel safe. And then lastly, we talk about healing, which is really healing each other, being empathetic, and really supporting our community and understanding our responsibility to our community to take care of them, especially when they're at their sickest, because that's really what we do. So that's a little bit of a long-winded answer, but I just love talking about our values.
Thank you,
Thank
Frank.
you, Frank. Thank you, Frank. What do the values of Nebraska medicine mean to you personally?
Well, there's so many things about it. I mean, when you look at our set of values, that very much aligns with who I am as a person, right? When we talk a lot about our values, and when you're looking for an employer, you have to think about, how do my values, personal values, line up with our organization? So one, for me, our values very much align with that. And then not only do they align, but do we kind of put our money where our mouth is on it, right? Like, we really believe this stuff. And that's what excites me, is because I think our organization is so grabbed onto these concepts. And we've been so intentional about making sure these are living and breathing. So the values to me are very meaningful when we select colleagues to come join us, because we think this is an amazing place to work. And I'm going to be like totally honest, we're not perfect. And we got our cuts and scars. But I think overall, when you put the whole package together, we're pretty awesome. And this is a really exciting, interesting place to work if you want to be challenged, not only academically, but emotionally and spiritually and intellectually. So all of those values really kind of mirror me a little bit, which is really exciting. So I don't feel like I have to come into work and be somebody different than I'm not. And I think that it's just a way for our workforce to really gravitate. And when you go through something like a COVID pandemic, I mean, you see our values living every day, and we really got conscious about them. And they helped be our North Star. And that was really cool.
Frank, tell us how the culture affects the departments at Nebraska Medicine.
Yeah, it's really good. A great question. So when we talk about our culture, what we essentially mean when we talk about organizational culture is, how do we work and behave together? How do we work as a team? What are, again, our expectations of us? So one, the culture, when you look at it down at the department level, it's first of all taking our big organizational values, and bringing them down to a department level where they really make things real for you. So at a department level, you get a much deeper feeling and understanding of what it means to work as a team. You get a much deeper understanding of what it means to innovate, what your safety practices are, how you call out safety practices, how you support one another in healing and having courage to say some things don't look right, or, sometimes it's just courageous to thank people and be grateful for the teammates that you have. So our department managers, what we want them to do is really to take these ITEACH values and bring them down at a department level where our workforce can really experience what we mean by those things. So that that, say Luke and Marla are on the same shift, that Luke knows Marla has her back and Marla knows Luke has his back. Because it requires that level of teamwork that you really want to experience at the department level, where it becomes really living and breathing. So I think it's really important there. And the manager, and Meg knows this as having been a manager, our managers really set the tone, our supervisors really set the tone about what that culture inside of that unit looks like. You heard it from Brandy and her team, they're the wolf pack, right? That kind of galvanizes that team. Let me tell you, that's an amazing team that has been through enormous things in the last 18 months. And you know what? They love each other. I mean, they just really are awesome, and they work really well together. And Brandy, by the way, is being very modest. She's an amazing man.
Thank you again, Frank. I think that Ashley and Denise, we were going to maybe jump to another set of questions specific to why Nebraska medicine for a few of our other leaders.
Yeah, absolutely. So with that, I guess, can you tell me, Frank, a little bit about your time at Nebraska Medicine, how long you've been here, and kind of the roles that you've held?
Sure. Well, I got really lucky. I've been here about 6 years. And I came here in 2015 as a consultant to come in and just help out the HR team for a while. And it was pretty clear and evident to me, almost like the first day I walked in, that there was this just sort of, wow, this feels really comfortable. And it really feels at home. And there's a really wonderful environment that you feel. I mean, like you can literally feel pride from our workforce just pouring down the hallway. And so that was really the journey. I'd been in healthcare a long time, worked at a lot of different healthcare systems. I came from the East Coast and immediately just gravitated here. And then over time, I would say over the first couple of months I was here, we started to have kind of feeling out conversations about staying and then taking over the HR organization and sort of bring it into the future, which is where I think we are now. I think we've done a lot of hard work. So I have really kind of a short story in the sense that I've been here in this role for 6 years. When I compare what the experiences are here with my experiences out east, it's not comparable. This is such a cool place to work. It's so much more enjoyable to come into work every day and to sort of be part of the Midwest and feel what it's like. This has just been really the whipped cream on top of my career, I gotta tell you.
Awesome. And then with Meg and Melanie, would love to get to know you guys, your careers here at Nebraska Medicine. And if you could share with the group, why you're continuing to choose to stay with Nebraska Medicine.
Sure, I'll go and I'll try to make mine quick because I've been at Nebraska Medicine a very, very long time. So my name is Meg Cordes and I manage with Melanie at Bellevue Medical Center, which is an amazing place to work. But I started my career way back in July of 1985. I know that seems impossible, but I've been with the organization for 37 years and I've been blessed to be in many roles. I started as a staff nurse in the ICU, moved on to a leadership role as a house supervisor or nursing resource coordinator on main campus. Then I got into management. I was an associate nurse manager and transitioned to the manager role. Currently, like I said, I am at Bellevue. I've been blessed to work with other teams at Nebraska Medicine. I think my story is one that is really obvious why you stay at Nebraska Medicine. Frank touched on our ITEACH values. They're amazing, and I really feel like they're ingrained in the culture at Nebraska Medicine. And the opportunities, the amazing people that you work with every single day. I love that our leaders like Frank and Corey and Julie and Sue, they know us personally, they round with us. They support us. There are probably not many organizations, I feel like, that our senior leaders really know our managers by first name status, and we can reach out to them and email them and talk with them. We have their cell phone numbers, so that is awesome. Opportunities to advance, do on the edge of research, anything that you want to experience, you would experience at Nebraska Medicine. Amazing people, amazing staff, and of course, the care of patient is always at the core of what we do. Being a nurse, that's what I love, and that's why I stay.
I would totally agree with Meg. I chose Nebraska Medicine Bellevue because I worked at a hospital in New Mexico. It was about the same size, and so that's what I was looking for. I am so happy that I picked Bellevue. I just feel supported in my role. I've been here for 6 years. I started as a med-surg nurse at the bedside and got offered an associate nurse manager position, and now I'm a manager. So like Meg said, when you want to continue to grow and learn. You have endless opportunities at Nebraska Medicine. She talks about the senior leadership and their support. There's always going to be challenges in healthcare. Right now, there's some nursing challenges, COVID challenges, all of that, but there's never a day that goes by that I don't feel like I have the support behind me from my team, from the upper leadership. It's been an amazing place to work. I don't plan on leaving. And I just love the people that I get to meet because the organization's so big. You're meeting new people all the time and building those great relationships. And we have an amazing team to work with. So.
If I could jump in, because I think Meg and Melanie both make a really interesting point, that Nebraska Medicine is actually big enough to give you any kind of experience you want. So they work down at Bellevue, and that has its own sort of different look and feel than, say, working up at the Med Center. And so in some cases, some nurses start down at Bellevue and then eventually make their way up to TNMC, or vice versa. They want to go back down to Bellevue because, again, it's a very different experience. We have experiences where you can work in clinical settings and ambulatory settings. You can be engaged in doing some work where in units that have a lot of research associated with them. So, our chief financial officer started off as a unit secretary in what was then called Clarkson Hospital. And she worked her way after, 20, 25 years. She took advantage of all the educational support that we provided and got into the finance department. And here it is, she's our chief financial officer. There are hundreds and hundreds, if not thousands, of stories of people having different careers inside of Nebraska Medicine. And I think that's one thing that's really, really cool about us. And I think those opportunities are going to be more than present for the future as well, as we grow and get bigger. And, there's probably some really cool opportunities I can't even tell you about because they don't exist today that'll exist in 5 years. So both of them made really good points there. And we love both of them, and both of them have to stay. So.
Thanks, Frank.
And if we have time, Marla, if you want to, I get the opportunity to work with Marla every day. She is phenomenal. She runs our lead 4 and 5 on the main campus. So Marla, if you want to give a quick 60-second rundown of your experience.
Yeah. So I've been here over 18 years, and I just have to say exactly what they said. I honestly started as a teenager here and went through college, have had multiple roles, and I give props to all my leaders along the way because they really are the ones that pushed me out of my comfort zone and maybe found strengths in me that I didn't even know I had. That then persuaded me to go back and get my master's in administration, and again, worked my way up from CNA to manager of the med-surg ortho floor. So it's been awesome. Don't plan to leave either. It's definitely a family. I've known these people for almost 20 years, a lot of my peers. So I couldn't imagine going anywhere else. So, yeah.
Well, thank you guys for being here today. Really appreciate you exploring Nebraska Medicine. We're really open and honest about who we are, what we do. We do have warts. We're not perfect, but we think we're pretty cool, and we think we're a really great.
Okay, welcome back, everybody. So I wanted to say at this point, thank you so much for everybody who attended this morning. Please feel free to go to our career site, nebraskamed.com/careers, if you are interested in looking at available positions that we have at Nebraska Medicine. Please feel free to email me any questions that you may have. We will be sending out a recording of this event as well as a survey this week to get your feedback, and then you'll have my contact information as well if you have any questions that I can assist you with. We would ask any new graduates or soon to be graduates to hang on with us for the last 20 minutes here. And Kaylee Guinan will be sharing about the nurse residency program for new graduates at Nebraska Medicine. But if you are an experienced nurse or you've gotten all the information that you needed. You are welcome to drop off or hang on with us and listen to Kaylee share about our nurse residency program.
Ashley, I just have a quick question. On the previous
Absolutely.
slide, your email was listed as A. Harrell at Nebraska Med, and now it's listed as AS Harrell.
Oh, yep, it is AS Harrell. Yep.
It is?
Yep, it is. Did I
Okay.
have it wrong? I'm sorry.
Okay,
Yes,
thank
it
you
is
very much.
AS Harrell at nebraskamed.com. Thank you for pointing that out. Great. Did we have any other questions before Kaylee started her presentation? Okay, perfect. Kaylee, if you would like to present on the nurse residency program, we would love to learn more.
Hi guys, like Ashley said, my name is Kaylee. I'm a nurse at Nebraska Medicine and I started here as a new grad, probably before you were born, and I never left. I had a path like they talked about. I started on, it was geriatric rehab unit. I thought I wanted to be a geriatric nurse practitioner someday. And I worked there for about 6 months and decided that was absolutely not what I wanted to do. And so I went to 5 West and I just loved it. It was absolutely amazing. I worked there as a staff nurse and a lead for about 7 years. And at the time, the floor split into 2 units. And I stuck with the unit, but moved to the new one, which was CPCU, but is now HVU. And so I did cardiology clinical nursing for about 15 years. During that whole time, I was precepting new people, or as the lead, I was helping new nurses on the floor to kind of guide their practice and develop their critical thinking. And I knew that was really what I wanted to do. And during those years, I had 3 kids. I worked every FTE, every shift, and I just made it work with my life. And that's what I appreciate most about Nebraska Medicine. I've been able to find my passion, make it work with my life. And after the 15 clinical years, I went to employee development where I did new colleague orientation, care provider and nursing orientation. And then that job kind of rolled into a couple others. And right now I'm the manager of nursing professional development. There are about 3 of me who look at house-wide needs, and then we have 40 nursing professional development specialists. You met Sarah, across all of Nebraska Medicine. So clinics, procedural areas, and hospital-based areas. And our whole job is to help people onboard to Nebraska Medicine, orient, develop, have the educational needs and do all of that. And I really, really found that this is my passion. So I've stuck with that. The favorite part of everything I do is this nurse residency program. So you guys, I'm sure, heard about this all through your nursing career, but we know without a doubt, evidence shows that it takes a year to transition into a new job of this clinical type, a whole year. And so we have had this program in place since about 2009. And the intent of the program is to support new grads through the first year of their practice. You will figure it out really quickly after you get out of school and start on the floor, but it's overwhelming how nursing school prepared you to be a nurse, but it's very different when the patient load is on you and all the decisions are on you. And this program helps you to think critically, become a bedside leader, and deal with the first year transition. So Ashley, if you can go to the next slide. Part of that first year transition is getting to know the people that you work with and establishing relationships with your peers. And so for nurse residency, what we do is we wait about a month or two after you start at the hospital, and we have a cohort of nurse residents. We do this 3 times a year to coincide with graduation dates. So all the July and August grads start on, I think it's November 7th. They'll start in the program together as a group. Same with May grads and December grads. And so we'll have a cohort of new nurses from all over the hospital, and we meet once a month for 11 months. And during that time, the first hour or two, we have a topic of the day, and the second hour or two, you meet with a small cohort group. So the morning session may be 70 people, but the cohort group will be about 10 nurses based on like area, and it follows a topic of the day. So for example, the topic of the day is resource management and communication. And that's what the first hour or two will be. And then the second hour or two, they'll talk about how that looks like on the floor and share stories with each other. And those small cohort groups kind of become your people. And honestly, some of my best friends are those that I started with as a young nurse, even 23 years later. And so that's how we do each section. If you go to the next slide. Or actually go to the schedule, Ashley. Yep. So this is what the schedule looks like. The program that we use is the Vizient AACN Nurse Residency Program, and that is the gold standard for the country. There's about, well, this year alone, there's 22,000 residents in that program. Nebraska Medicine has 250 of them. But we know that this program is evidence-based. That's how we know it takes a year to transition. We also have a lot of data from both the Vizient and Nebraska Medicine past residents. So we know what new nurses need and when they need it. And that's how we build the program. So we start with intro to the program and getting to know what the next year will look like. And we talk about self-care. Then we'll talk about resource management, medication safety, evidence-based practice. And as you go through the year, the topics get a little bit deeper to meet you where you're at. Go back up to this one. So the schedule is based on that, as is this transition. If you start on the left-hand side where it has well-being down to distress, that's when you start a program. That access is the bottom is if you're just a mess, and the top is if you're perfectly happy, healthy, well-adjusted. And you all know we're a spectrum of that every day of our lives. And then the bottom access to the left of the slide is the first starting as a new nurse. And as you go to the right, it goes through the 12 months of your first year. This is why we feel strongly that residents need a program and why Nebraska Medicine has committed these resources to develop you guys. We know that when you start as a nurse, you have, we call it the honeymoon phase. You're happy. You are so excited. You've told everyone you know you're a nurse, you pass boards, you start, you're excited to put in a catheter. Like everything is new and exciting. This is what you've studied 4 years for. This is what you're doing with life. You're way up in the clouds with excitement. That phase lasts for only about 5 to 6 months, and then you transfer to the shock phase. The shock phase is when you think, oh my gosh, what did I do? I can't believe I'm doing this. You sort of just have a lot of confusion and anxiety and, oh my gosh, just shock, okay? That's the low point of your year. After the shock phase, you hit the recovery phase, and that's the upward climb of you starting to be able to balance like, oh, it's not that bad, or this is good and this is bad, and you can process everything you've learned and where you're at, and you kind of climb up. And then the last phase is when you completely resolve that and you're kind of done with the transition. We know this is absolutely the route that people go through on the first year of a new job. So if we know that, we can do things to make you not hit as low and recover faster. And that's what the blue line in this slide is showing. And so we put a lot of supports and education and resources in place to help you, because we don't want you to hit that low point of the shock phase, and we want you to recover faster. That's what the nurse residency program is all about. In addition to the nurse residency program, we have a lot of leaders and preceptors out there supporting new people, new grad or not. We're checking in on you all the time. We're making sure that you're doing okay. We're setting you up for success, and we're really looking out for you. And then after you come off that blue line, you're through the transition. And we know that nurses who go through the program are more confident and competent professional nurses. You can put the slides down, Ashley. I'm just going to talk for a bit. The nurse residency program really, I think, helps, like I said, to support people, and it really focuses on a few key threads that we have in every month of the program: bedside leadership, professional development, developing you as a clinical nurse. All of those are built into the program. I want to clear up one thing that I think confuses a lot of people. Nurse residency is an orientation. And so when people start, they have an orientation, depending on where they're going, of about 6 to 10 weeks. That's orientation. We also have nurse residency. We also have clinical fellowships. We also have additional classes depending on what you're doing. For example, if you're on an oncology floor that gives chemo, you take a chemo class. So all of these different categories are kind of part of you learning and developing through your first year, and all of them together really make for successful nurses. And those successful nurses then have the foundation to do anything in the future, because they have the skills and they're prepared for it. So that's kind of the overview of the nurse residency program. Are there any specific questions?
I have a quick question. Does every new nurse, like new grad, or do they all go through this program?
Every new grad nurse who's in a hospital-based setting. And so no matter what floor you were on, you go through it. You don't have to apply. It's not a competitive process. Everyone who starts is included in it. We have something a little different for the ambulatory areas, because that's a whole new world. But everyone will go through it. And we do about 250 new nurses a year.
Are Bellevue and main campus nurses combined, or does Bellevue campus do it separately?
They do. It depends on how many people are there, but Bellevue's absolutely included. Sometimes we make Bellevue its own cohort group. And so they'll Zoom to the morning first hour or two if they're doing an activity at Bellevue afterwards. But yeah, everyone's included.
And at this time, is it being done via Zoom, or are you guys meeting?
It depends on the group. Right now, we have a room restriction of 25 people per room, unless it's like a theater. But we don't have that right now because because they're doing flu shots in that room. And so when we do the sessions, usually the cohort groups will meet in person in smaller rooms and Zoom into the topics of the day. And so those 10 or so people will be in a room together, but we'll have 7 rooms of 10 people. When the restrictions aren't there, we meet in person. It's just part of it is socializing, and we like people to get to know each other because you see them all over the place.
Great. And we had another question in the chat. So you meet once a month for 11 months.
Yep.
Okay.
Yep, it's 3 to 4 hours a month. It's considered part of your work schedule, so it's paid time. We have the calendar about a year in advance. And so when you start in nursing orientation day 1, we hand you a schedule and we tell you what cohort you're in. And then it's just built into your activities.
Great, thank you. Were there other questions for Kaylee?
I'll put my email in the chat. My real name's Michaela, so I swear it's me, but you're welcome to reach out. We have, I think someone mentioned there's an onboarding packet, and there's also a nurse residency flyer that gives some of those details, and you're welcome to reach out to me at any time.
Thank you so much, Kaylee, for sharing all of that information. So that brings us kind of to the end of our open house today. Again, I would encourage you to visit our nebraskamed.com/career site to look at different openings that may be of interest to you. Just to reiterate, if you are a new graduate or soon to be new graduate nurse, you are welcome and encouraged to apply within that 6 months. So you can start applying 6 months before your graduation. Go through that interview and application process and kind of get that taken care of so you don't have to worry about that throughout your last semester. And then that position would be held for you until you are ready to start working. And thank you so much for everybody who attended. And if you have any questions, please feel free to reach out. I would be happy to answer anything that you may have lingering in the back of your head. Okay, well, thank you all so much. Have a great rest of your Saturday.